2 months in, and the official language has caught up with the numbers. The response is being outpaced. If you're just joining us, DRC's Bundibugyo virus outbreak began in Ituri, and it's now spread across 5 provinces. The biggest concern is the transport hub of Kisangani. Before today, MSF was already warning that containment was falling behind. More than 2,000 confirmed cases, 750 deaths, plus armed conflict, missed contact chains, and attacks on responders all working against the response.
This is Ebola Watch. Today, a fresh case count, a new Africa CDC plan with big names attached, and whether any of it actually changes what's happening on the ground. DRC Bundibugyo Ebola outbreak isn't over. Follow us wherever you're listening, and the next chapter comes to you.
Health Policy Watch with Carrie Cullinan.
2 months after the Democratic Republic of Congo, DRC, declared an outbreak of Ebola Bundibugyo, the outbreak is continuing to outpace the response. And with 2,073 people infected and 796 dead, this is the fastest outbreak ever. World Health Organization (WHO) Director General Dr. Tedros Adhanom Ghebreyesus told a media briefing on Thursday.
The number to hold on to today? 2,073 confirmed infections and 796 deaths per WHO's Thursday briefing. Confirmed, both of them. And Tedros gave it a frame that's hard to shake. The 2018 outbreak took 10 months to reach 2,000 cases. This one did it in 2.
So do the math on that with me. 796 dead out of 2,073. You're looking at a case fatality rate pushing 38%, a number listeners can actually hold on to, and steeper than what we were working with when we covered the vaccine trial launch on Monday.
And here's the line that should worry people more than the count. Tedros says more than 80% of new cases are turning up outside known contact lists. You can't chase transmission you can't see.
2/3 of the deaths are in the community, people who never made it to a health facility at all. So the official count is almost certainly an undercount. And a treatment center in Bunia was attacked Wednesday. How do you run a response through that?
Africa24 TV, with Africa Centers for Disease Control and Prevention, Africa CDC.
The government of the Democratic Republic of the Congo and response partners have activated an emergency delivery roadmap to break the transmission of the Bundibugyo Ebola virus, placing immediate deadlines and clear operational responsibility behind the measures known to stop Ebola: early detection, complete contact follow-up, rapid access to care, protection of health workers, and trusted community engagement.
Okay, this is the machinery behind the numbers we just walked through. Africa CDC calls it an emergency delivery roadmap. And the word that jumps out to me is deadlines. It puts immediate deadlines and named responsibility on the steps that actually stop Ebola.
And read the 4 pillars carefully, Daniel. Early detection, complete contact follow-up, rapid access to care, protection of health workers. The plan turns surveillance and contact tracing into deliverables. That's exactly where the response got exposed this week.
So it does answer part of that. The blind spot, where cases are actually starting, is on the dashboard now, at least on paper.
On paper. The roadmap was adopted in a strategic review chaired by Dr. Roger Kamba, with Dr. Jean Kaseya of Africa CDC in the room. It sets up a common performance dashboard for decisions, deadlines, and results. The structure exists. Now we watch whether Butembo actually sees a dose or a contact tracer because of it.
And notice the count in this release. 2,011 confirmed, 754 deaths as of July 13. The Health Policy Watch piece we just hit had 2,073 and 796. Same outbreak, 3 days apart, and the deaths climbed. 54 new confirmed cases in a single 24-hour window.
From World Health Organization.
Building on the emergency scientific consultation convened on 22 May 2026, following the declaration of the Bundibugyo virus disease outbreak as a public health emergency of international concern, PHEIC, the Filovirus Collaborative Open Research Consortium, CORC, led by ANRS-MIE, together with Africa CDC and the WHO R&D Blueprint for Epidemics, will convene a follow-up scientific and operational update meeting.
This one's a scheduling item, but with weight behind it. The Filovirus Cork, led by ANRS-MIE with Africa CDC and the WHO R&D Blueprint, meets today at 1300 Geneva time to review where the research actually stands. And it goes straight back to the emergency consultation on May 22nd, the day this was declared a public health emergency of international concern. So today's review sits in the same chain, from the consultation to the EBO PEP trial, and now to a formal progress review.
Right, but 2 months on, and past 2,000 cases, especially after the segment we just aired, I keep coming back to whether that pipeline has actually moved, or whether today's meeting is a room full of people agreeing there's still no dose ready to ship.
The agenda has an EBO PEP line item, Daniel. The ANRS-MIE consortium is the same group that enrolled that trial back on July 14th. So I'm watching how the IMST technical work in Uganda fits with this research agenda. Coordinated or running its own lane?
And I'd add, the Serum Institute already bet on a 620,000 dose pre-trial stockpile. If today's timeline shifts, that bet either looks smart or premature. Keep 620,000 in your head.
If you follow Ebola Watch for clear outbreak updates, you might also like Hantavirus Watch. Daily updates on the 2026 outbreak, including the MV Hondius Andes virus cluster, CDC and WHO response, contact tracing, and traveler risk. Find it wherever you listen to podcasts. What we're watching next. WHO's virtual Bundibugyo MCM research update is scheduled for today, July 17th, from 13 to 1500 Central European Time. We've put links to every story in the show notes, so if something caught your ear, you can follow it there and read further. That's Ebola Watch for today. This is a Lantern podcast.